Mexican investigative documents show an anonymous tip led authorities to a remote shack where 4 kidnapped Americans were held. Thank you for staying with us at 9:30 on the CW. I'm Jonathan Cooper.
And I'm Tatum Gwynn. Inside the shack, the documents said Latavia Tay McGee and Eric Williams were blindfolded, but beside them, Shaid Woodard and Zindell Brown were found dead. The Scorpions faction of the Gulf Cartel issued a public apology, saying the kidnappers had gone against the cartel's rules, which include respecting the life and well-being of the innocent. The apology letter was with 5 members of the cartel found tied up face down on the pavement. Those men have now been charged with aggravated kidnapping and homicide. One of 4 kidnapped Americans had traveled there for a medical procedure.
Patients Beyond Borders is a group that helps connect people with health providers outside the U.S. They say depending where you go and what type of procedure you're getting, people can save 20 to 90%. News on 6's Ashlyn Brothers is live with the doctor's advice. Ashlyn?
Well, Jonathan and Tatum, a lot of people are choosing to go out of the country for surgeries and medications because it's so much cheaper, but it can also be more dangerous. Americans go overseas because they don't have to wait a long time to get treatments, and they can get procedures that aren't approved or available in the U.S. Weight loss surgeries are one of the most common.
Unfortunately, coverage for obesity treatment is lacking in America. We should be writing our state representatives and our national representatives and talking to our employers and getting coverage for a disease.
But getting a procedure done internationally can come at its own cost, depending on the person's condition and where they're traveling. Many people travel too soon after surgery, sometimes don't get the quality of care that can lead to infections, and there are often language barriers. Bailey Bariatrics in Owasso says if you go overseas for a surgery and you come home with complications, you'd have to go to an ER because they only accept patients from other centers of excellence.
There are so many patients that do that we need room in our programs to take care of our patients because of the cost of the lack of coverage for correcting surgical problems electively, and the lack of coverage of that, the hospital just unfortunately couldn't afford to bear that cost.
Dr. Gaffney says a thorough pre-screening process is how they ensure people are getting the right type of surgery the first time. And she says care doesn't stop after surgery.
Pre-operatively, we call it like training for a race. The surgery is not the end of your race. The surgery is the beginning of your race.
She sees patients every 3 months for 2 years after surgery. Experts say before you go get your procedure, talk to your doctor here, do your research, and then also make sure that you get that international insurance. They say also when you go, bring your medical records. Live in Owasso, Ashlyn Brothers, Oklahoma's Own News on